Shalom. Pay close attention to what the so-called good doctor is going to say about how they are terrorizing nursing homes and the feeble, the people in this country that are not physically capable of fighting off sickness and disease, or that are under current medical attention, whereas their bodies are just not strong enough to withstand fighting off a sickness. Listen to what the good doctor is going to say, because many of you are convinced that this coronavirus is some new thing because you heard the media saying it's new. It's not new. It's not new at all. This is an attack on the geriatric. Understand what I'm saying? This is an attack on the geriatric and also an attack on the little babes. Yahweh Shai Hamashiach, he's not pleased with what's going on, and he's going to turn this thing against them.
Washington State has confirmed a person with coronavirus has died. The man in his 50s with underlying health issues is the first virus-related death in the U.S.
At this point, we do not have widespread community-wide transmission locally. We have transmission that's associated with an outbreak at this long-term care facility.
This as more coronavirus cases emerge on the West Coast, and more countries are announcing their first cases, all raising concerns of a potential pandemic. President Trump spoke from the White House.
Our country is prepared for any circumstance. We hope it's not going to be a major circumstance. It'll be a smaller circumstance, but whatever the circumstance is, we're prepared.
The Trump administration is also adding more travel restrictions to specific regions in Italy and South Korea. The CDC now permitting states to do their own virus testing. The goal is to have every state and local health department up and running by next week with testing kits. And the FDA will now allow accredited labs to conduct the tests. Tests that come back positive will then go to CDC headquarters in Atlanta for confirmation. Meanwhile, more people who contracted COVID-19 without being in contact with those who are sick or traveling are popping up. In Oregon, their first presumptive case of COVID-19, a school employee who may have exposed students and staff. Public health officials urging caution and vowing to limit transmission. While most cases appear to be mild, states are doing what they can to contain the virus. And as more testing kits become available, the number of diagnosed cases are likely to go up. Andrea Fujii, ABC News, New York.
Yeah, right now the CDC has a team on its way to Western Washington. They're expected to arrive tonight and be on the ground tomorrow in Kirkland to help at that skilled nursing facility. And once again, there are 2 people in the hospital tonight, one at Overlake and one at Evergreen Health. And sadly, that first death in our state, in our whole country. One man in his 50s, he did have some other health issues. And part of the issue and part of the reason why they're finding some more of these cases right now is because they just expanded the testing here at the lab. They dropped some of the requirements for testing, and they say because of that, they're going to find more of these cases in our communities.
You know, we do feel that the risk to the general public is increasing. We do not feel that the risk that transmission is occurring on a widespread basis by any means.
More cases of coronavirus, and now the first death. A man in his 50s who was chronically ill.
But it was somebody that had underlying risk factors for severe disease. It was one of the things that prompted us to test him. Because of that, we felt he was at a higher risk and had an unexplained respiratory infection.
The man had not traveled or had any known contact with someone who had the virus. The health department is also investigating how those at the care facility got sick, but they say not everyone will require treatment.
Most people with COVID-19 do have mild illness. A smaller proportion will have severe illness, and that is why we are working extremely hard to try to decrease the spread of this virus in Washington.
They could eventually cancel schools and large public gatherings. It's not to that level yet. But King County Executive Dow Constantine confirmed he will bring his cabinet together this weekend to see if some county employees can start working from home. And right now, this state lab is the only place in the state of Washington where they can get any testing done. They get a presumed positive result that they still do send on to the CDC for confirmation. They tell us they're working to try and get a few other labs on board. Right now, they said they're going to be processing samples 7 days a week, and they can get same-day results and expect to continue this throughout the weekend. We're live in Shoreline. Amy Marino, King 5 News.
Hi guys, here's what we know tonight. 2 people were diagnosed with coronavirus at the Life Care Center of Kirkland Nursing Home, where we are set up tonight. The nursing home and doctors, the health department, they're monitoring more than 50 other people associated with this nursing home who now are sick and have some respiratory issues. They're being monitored and tested for coronavirus. All day long, people who have family members who live here have been coming by trying to visit, and they have a lot of questions tonight.
People who tried to visit their family members at Life Care Center of Kirkland were turned away.
They just said no visitors today for the safety of the patients and the people coming in.
2 people, a caretaker in her 40s and a resident in her 70s, tested positive for coronavirus, and doctors are concerned an outbreak may be happening here. Public Health King County says more than 50 others associated with Life Care who have respiratory symptoms are being monitored. Some are quarantined.
I know they'll do the best they can to contain it.
Early Saturday afternoon, Kirkland firefighters showed up wearing protective gear and loaded a patient into an ambulance. You're not getting any answers?
Zero. Zilch.
I spoke on the phone with Pat Patton of Kirkland, whose wife lives at Life Care and is recovering from a stroke. He has not been able to reach her.
So you're concerned that there may have been an exposure here?
Yes, I'm personal exposure as well as for my wife.
Because you've been visiting her, right?
Yes, I visit her every day, sometimes twice a day. You couldn't help but worry about her being there, but you'd be more worried if it happened to be one of her roommates. I'm sure they're doing what they need to do or what they've been told to do.
Both of the people who tested positive for coronavirus here are in the hospital. The healthcare worker is in satisfactory condition, and the resident is in serious condition. And I have some new information we just got in the past few minutes. This is about Lake Washington Institute of Technology. I'm told 16 of their nursing students visited this nursing home in the days before these people were diagnosed with coronavirus. They said it happened late last week. The school tells me it is disinfecting its campus this weekend, scrubbing all of the surfaces, trying to clean everything it can. They say they're trying to coordinate with King County public health officials to come up with a plan for what to do with those 16 students. Do they put them in quarantine? What kind of guidance do they give them? How will they be monitored? That's all very much in the works right now. The school just sent out a statement to its entire community, basically outlining what they know at this point. But there are still some questions about, did these students spend some time here as that virus was spreading, then go back to campus unknowingly and potentially spread that to others? As we know tonight, they're not under any kind of quarantine. We're still trying to get those answers tonight, and the school has not made a decision yet about whether it will open on Monday, but they say the plan right now is to do that. Live in Kirkland, Ted Land, King 5 News.